Hello friends, just wanted to give you an update on having my port installed and then just a few days later starting my first round of chemotherapy. And first of all, I have my port, which everybody commented on at the cancer center that they'd never seen one over here. So my port is actually over here because my breast surgeon was the one who inserted it, and he'll be doing the lumpectomy down the road. So being a breast surgeon, he's just concerned with aesthetics and didn't want me to have any scarring. So it makes it a little challenging on figuring out what to wear when I go for chemotherapy, but it all worked out well. Just wore a tank top and wore a cardigan sweater over to help keep me warm. So first chemotherapy session obviously was very anxious and apprehensive to get it started, but once the process went on, I just got my mind wrapped around it that this is what was going to happen in order to give me the best chances of survivability. So I am a HER2 triple positive, stage 2B. So I have just the cancer on the one side and the lymph nodes on the same side as well. So coming from a person that has never been on any medication except for an occasional round of antibiotics, I don't even like to take a Tylenol. It was a little bit overwhelming to know that I was going to have 8 different IV bags of medications given to me. All obviously serve a purpose between the anti-nausea medication and the Benadryl and the Decadron, which is the steroid. And so my cocktail is what's known as TCHP. So I am on docetaxel, which I guess is called Traxater. Sorry if I said that wrong. Carboplatin. And my Herceptin is Trazimera. And then the other targeted immunotherapy is Perjeta. So they did the 2 chemotherapy drugs last. They did each bag one by one, just in case I had a reaction, so they would know which one it was. So after the pre-meds were done, I'm guessing the steroids and the anti-nausea ones, I did have to sit for an hour, and all those drips were done at varying lengths. The docetaxel, I will give you a heads up, is very potent. It does have alcohol in it. I guess from what I hear, it's about 23% alcohol, so I'm so glad that I had my daughter take me there and who was going to take me home, because there is absolutely no way I was going to be able to drive home. The first dose, or first chemotherapy round, the Benadryl was maxed out, and the quickest rate that they could give me was, I think, at 20 minutes, but I know within 10 minutes of receiving it, I was ready for a good nappy nap. So that's where I wish I would have brought in a pillow, because the recliners just don't kind of fold all the way back. They mostly recline, but just not all the way back. So other than that, I can tell you some of the symptoms I felt while I was getting the chemotherapy drugs were, I could feel my tongue starting to kind of get a little burn sensation in it. I could feel my hair follicles tingling a little bit. I washed my hair yesterday. Typically it's a little bit fuller, but I do know I'm prepared. Next week it's probably going to start falling out in clumps. So yeah, that'll be interesting, and then we'll just kind of get creative with what I do. So first round out of 6, I feel pretty good. That's to be expected, I guess. Not too many symptoms. I did go in yesterday, which is the day after chemo. I had chemo done on Monday. Tuesday I went in to get my Udenica injection to help boost my white blood cells. Fairly comfortable injection. I mean, it did burn. They can't give it quick. They had to give it over like a 2-minute, 3-minute period. But that was done around 5 o'clock in the evening. By midnight, I had a pretty good bone and joint pains. I've heard to take Claritin. I started taking Claritin a week ago, a week before chemo, in preparation, because I do know that helps out with some of the bone pain. Acetaminophen kind of helped. So far, so good. I have a little bit of redness in my chest area here, but that's normal side effect, I guess, from the injection that I received yesterday. So that's all I got for now. And the next round will be in 2 weeks. So talk to you later.